Ever had that annoying itch deep in your ear after diving, surfing, or maybe spending all day in the swimming pool? By the evening, it turns into the sharp pain that keeps you up all the night. Sounds familiar? That's swimmer's ear. One of the most common reasons why surfers, divers, kids, even their parents ends up at the ENT doctor during the summer. My name is Daria, I'm an ENT doctor, and today I will explain why this swimmer's ear happens, what people are at risk, and the most important, how to prevent it, so you can keep your precious ear safe. Stay here. So what is exactly the swimmer's ear or outer ear infection? Our outer ear is here and here, everything before eardrum, and it's covered with skin. So inflammation of the skin called swimmer's ear or external ear infection. Your ear canal is really good to defend itself, but too much water here or some skin damage after scratching, cotton buds, or maybe over-enthusiastic cleaning is a perfect chance for bacteria to move in, unpack their bags, and start multiplying like crazy. It's really great environment for bacteria, warm, wet, dark. It's basically a luxury spa for germs. Okay, with scratching it's pretty clear, but why water exposure triggers an ear infections? With frequent immersion, water swells the cells lining the ear canal. These cells separate far enough for bacteria that normally found on the surface of your skin to penetrate inside the skin and start to multiplying there. So, if we summarize, in most cases the breakdown of protective barrier of your skin leads to infections. So who is most at risk? Swimmer's ear. Of course, swimmers, divers, and surfers, because they experience frequent immersion of water in the ear, especially the ones who have narrow ear canal, exostosis, or wax plug, because it traps water in the ear. People living in a warm and humid climate. That's a predisposing factor because bacteria really like this environment. People with chronic skin condition on the ear because the protective lining of the skin barrier is weak, and also people with a zero earwax because earwax is basically a natural antibacterial lotion. Frequent cotton bud users, and also people with diabetes and weak immune system. So how to spot it? Itchy ear that turns into the pain, and this is a really important sign. Pain that really spikes when you press your tragus here or pull your ear. Also, you can see swelling, redness, or sometimes weird discharge from your ear. The movement of your jaw or open your mouth could be uncomfortable, and in bad cases, fever and swollen lymph nodes. So, what to do? There is 3 important points to treat swimmer's ear. Point number 1. No water in that ear until it's fully recovered. It takes around 7 till 10 days. This is really crucial because inflamed skin becomes soft and loses part of its protective function, so it significantly increases the risk of reinfection. Point number 2. Let the doctor clean your ear if there is any gunk inside or builds up, because if you leave it there, it can cause reinfection in future. Point number 3. Topical treatment. You don't really need oral antibiotics to treat swimmer's ear. Topical treatment in most cases is enough. You can use antibiotics and anti-inflammatory ear drops or some cream, but it should be prescribed by doctor because you need to be sure that your eardrum is intact, because some of these drops can cause hearing damage. And now the most important one, prevention tips for water lovers. So rule number 1, dry your ear after swimming. You can just let gravity do the work by tilt your head and pull your earlobe, or even better, use hair dryer in low mode. Put it away around 30 centimeters, don't roast your ear. Rule number 2, avoid poking inside your ear with some cotton buds or fingers. Remember about this delicate skin of the ear canal that it's really easy to damage. And for those who are at risk and already sure that their eardrum is intact, can use alcohol vinegar drops mix. 3 drops in each ear after diving can keep germs away. So after this video, I hope you will never ever experience swimmer's ear anymore, because you know why it's happened and how to prevent it. Don't forget to subscribe, give a like, and see you next time.